to the third session of our webinar series, themed Testing, Tracking and Treating, brought to you by Africa Health Business. My name is Christine Hoogendoorn and I'm the Business Development Manager at AHB. Before I introduce you to today's moderator and we start the webinar, I would like to take you through some housekeeping rules. Attendees will be on mute during the session. Please note that you can post your questions in the Q&A section on your screen, and your typed questions will be responded to as much as possible. This is a 90 minutes event. Please observe the allocated time during the session. This webinar will be held in English. If you would like to listen to the French translations, please click on the translation button on your screen and mute the original audio. I would also like to take this opportunity to show you a couple of short videos from our event partners who have contributed to this event. We're very happy that you're here and a very warm welcome to all of you.
Pediatric cardiothoracic surgeon, pediatric endocrinologist.
There's one hospital where your child will receive more specialist care than in any other private facility in South Africa.
Gene surgeon, pediatric genetic.
The Pediatric Center at Lenmed eThekwini Hospital and Heart Center. You don't need to know what their titles mean to know how much it means for your son or daughter.
Pediatric pulmonologist.
Lenmed eThekwini Hospital and Heart Center. Your child deserves the best.
We are Broadreach, a group of distinct businesses focused on a common goal of improving the health and well-being of underserved populations around the world.
We are Broadreach Healthcare. We focus on winning and delivering large-scale health system strengthening programs for donors like USAID in programs like APACE.
We are Broadreach Consulting. We implement Vantage and provide associated change consulting to help clients improve their healthcare outcomes.
We are Vantage Technologies. We develop the Vantage platform that enables delivery consistently and at scale.
Together, we make up the Broadreach Group, empowering action,
changing lives.
Here you see the agenda for today's event, themed Testing, Tracking and Treating. I would like to reiterate that this is a 90-minute session. And now it's my great pleasure to introduce you to the moderator for today's webinar, Dr. Amit Tucker, who is the chairman of Africa Health Business. Welcome, Amit, and enjoy the webinar.
Thank you, Christine. Thank you, delegates. Thank you, panelists. Thank you, our keynote speaker, for tuning in today. I wish you happy holidays if you're celebrating holiday, whichever part of the world you're in. This is an extremely important topic, testing, tracking, and treating, that we'll be discussing in the 90 minutes that's coming up. I'm extremely delighted with the mix of the panelists we have that are going to take us through each one of the thematic areas in depth. And I couldn't think that we have a better opportunity in Africa than now to cement our efforts on testing, tracking, and treating. We have learned a lot on COVID-19 since what we have found out since its outbreak in later parts of 2019 in China. And we've seen what's happened in Europe, US, and other parts of the world. If you look at Africa, on 14th February, we found our first case. And on the left, you will see the way it's moved on. And in 31st July, we are almost at 1 million cases in Africa. And it's really, really scary the way it's accelerating. But we don't need to panic. And to change panic from the flight approach, Africa needs to take the fight approach. And on the left, you will see how the testing, tracking, and treating will be contributed to many of our panelists today. We have Africa CDC at the center point of interventions in this continent, and you'll hear more about it from our keynote speaker, the director of Africa CDC, John Kengasong, on how we need to flatten the curve. The three fundamental pillars is to prevent transmission, prevent mortality, and prevent social harm. These difficult choices that the governments and heads of state and ministries of health have to make are extremely important at this stage to reduce the economic and health damage that may be caused by a higher number of COVID infections and COVID deaths. Kenya Vision 2030 has also joined us as an arm of the Kenyan government to give an overarching model of how governments can intervene effectively to reduce this spread. On the right, you will see some challenges which are known as the risers. On the left, we have the 3 flatteners that we'll talk about, and on the right, we have the 3 risers. If we go in any way of haphazard interventions, inconsistent messages, non-targeted public health approaches, we will have crisis. And that crisis will be damaging for Africa. The second point, which is of utmost importance, is this is our responsibility, everyone on this continent, and in fact, around the world. You can never ask someone to take care of the COVID situation just from the government or from partners and other institutions. It's individual responsibility. So the messaging needs to be clear, and we need to really cut out all the myths and false information. Leadership is going to be tested and will stand this time of the surge. And financial indiscipline will result in loss of lives. Whether it's buying PPEs or it's buying testing kits, everyone in this space needs to express great level of resource management and strong partnerships. And here at Africa Health Business, we are dedicated to build strong partnerships, strong private sector engagement, and strong resource mobilization to help us flatten the curve. Let me now take this time to invite our speakers and our panelists, and join me in welcoming today our keynote speaker, who is at the forefront of making sure that we have an effective continental strategy. It's none other than the Director of Africa CDC, John Kengasong. John, delighted to have you. Over to you.
Thank you, Amit. Can you hear me?
Very clearly.
Okay, wonderful. Thank you so much for your, you talk of great leadership. Leadership is really exercised at different levels, and AHBS has exercised wonderful leadership in this pandemic. I think it is one of those forums that each time you reach out to me, I feel honored to be part of that discussion, because it is very lively, engaging, and it's really action-oriented. So I also recognize that my very good friend, Renuka Gade, is on the call, and she has been an ally and in this struggle, not just the COVID-19 struggle, but the HIV struggle for many years, especially in my private life, where we launched the Laboratory for Life. And I think, no pressure, Renuka, but I hope that we're at the end of this tremendous partnership from the private sector will be orchestrated using your dynamic and dynamism, which you always exercise. So let me, dear colleagues, kind of frame my reflections in 3. First, I will touch a little bit on the statistics of the continent as we speak today. And then second, I will discuss the hope that we have for the continent and what we must do to achieve that hope for the continent. And then thirdly, I would talk about how, as we ease the lockdown, what should we be collectively doing? And lastly, I will conclude with some reflection on what the continent should be rallying around. So first of all, the statistics. Very briefly, I think I will save time for others, but as we speak, we are really at around 100,000 short of 1 million cases. So to be very specific, 908,000 as a continent. And of those, unfortunately, 19,000 people have died. And the good news is that about 556,000 people have recovered. I really like to underline that number, the 556,000, because it offers hope. And in challenges like these, we talk of when you are challenged, it leads to endurance, and it leads to character, and it leads to hope. And if we are not hopeful, we cannot, as Amit said, ever fight this fight. I think this is not the time to be afraid. This is the time to face the facts, take our data and our situation, look at it, and then be brave and go out and fight it, because this is a fight for our existence. So the good news is that 556,000 people have recovered. The question we have to collectively address is, who are these people who have recovered? And who have been infected in Africa, and how many people are asymptomatic? In HIV, I spent 29 years in HIV/AIDS work, and we used to have a slogan that said, "Know your epidemic," and so that you can properly design the response. In the COVID response, I would say, I'll borrow from the HIV word to say that you have to know your pandemic. And knowing your pandemic is knowing who is infected, why they're infected, how they're infected, and who has recovered. The second thing that I'd like to touch on, then I move on to the second part of my reflection, is that of the 55 countries that make up the African Union, 37 of them are reporting less than 5,000 cases. I'll repeat, 37 of them. And if you push the analysis a little bit further, 7 countries are reporting between 5,000 and 10,000 cases there. So why do I emphasize this? It is essentially because I think that we still have a very strong window of opportunity to fight the fight and blunt this pandemic on our continent. If 43 countries or so out of the 55, if we do the right things and do it boldly and aggressively, then we have a very strong chance of winning that fight in the spirit of mitigating the impact. So let me now share my reflection on the second part, which is what must we do, such that those countries, about 45 countries of the 55 need to do, is the PACT strategy we launched, the Partnership to Accelerate COVID Testing, which is underpinned by the need to test, the need to track, and the need to track or trace, and the need to treat people. We were very deliberate when we launched this in April, where we look at our continent as a whole. And at that time in April, as a continent of 1.3 billion people, we had conducted about 350,000 tests. I know that I mean, people may think that because I'm not a native English speaker, I didn't say it right. It's 350,000 tests for a continent of 1.3 billion people. So we look at that and we say, well, you don't, there's no way you go to war without ammunition. We were literally fighting a war without ammunition in our hands. So we launched the PACT strategy, the Partnership to Accelerate COVID Testing. And I'm pleased today to say that as a continent, we've now conducted about 8.3 million tests. And the Africa CDC has been very instrumental in distributing more than 5 million of those tests. And it's not enough. As a continent, we should be testing about 13 million tests, and which will represent just 1% of the continent of 1.3 billion people. But that is what we need to be doing as a continent. So we've developed the PACT strategy, which initial goal was 10 million. As I say, we are very, very close to achieving our first goal, but we need to scale that up. The second part of that bigger goal, was that if you test and you do not trace the people and you do the right thing, isolate them, conduct quarantine, and then it's really literally not being effective as a tool. This is not a TB test or malaria test where you test for 2 weeks, you go get the results, and I mean, that will be clinical management, not public health intervention. So we then call for the continent to deploy 1 million community workers that can support the contact tracing, so that you apply what you call the standard shoe leather epidemiology, the foot soldiers, and to find the cases, isolate them, and then do the needful. And then, of course, lastly, treating the people that are infected. Luckily, as a continent, we have not seen an explosion of deaths, because about 70% of our infections are symptomatic. And as I speak, 4 of my colleagues have been infected at the Africa CDC, and they are at home. I just called them this morning since last week, and they're all fine. So thank you, Director, for calling. We are all fine. I say, if you need any help, let me know. I'll come stop by your door and drop you food, drop you everything there. So we are still very fortunate that we are not falling dead as had been projected. However, we need to provide space for and apply innovation in order to adapt our hospitals so that they can better take care of those who will be sick and do not disrupt existing services. And that brings me to what Amit had touched on. When we developed the strategy, the Joint Continental Strategy that was endorsed by the Bureau of the Head of States, it was underpinned by the need to cooperate, to collaborate, to coordinate, and to communicate. And they had three goals. One was to prevent, to limit transmission. The second goal was to limit deaths. And the third goal was to limit harm. Harm here was both economic harm as well as harm to other diseases. We should always remember, as we push on this struggle, that about 1.2 million Africans die every year due to HIV, malaria, and tuberculosis. Each year, 1.2 million. We should always remember that pandemics have a unique way of disrupting immunization so that we do not even reach our goals for immunizing our children. I think in the West Africa Ebola crisis, about 1 million children went unvaccinated because of Ebola. That lasted for 1 or 2 years. So we should keep that in mind, that we do not disrupt that harm. My third component of this reflection is about the easing of the lockdown. In a couple of days or weeks, the Africa CDC and the African Union Commission will be launching a campaign called Saving Lives, Saving Economies, underpinned by knowing your status. Sounds familiar? You may remember the slogan, Renoka and others who have been in the HIV struggle for years. We used to talk about know your status in HIV. This is the time. Knowing your status says that I want to protect myself and I want to protect my neighbor, because we are each other's keeper and neighbor. So if we do that, it will be underpinned by three protections: protecting the borders and travelers, protecting the economy using technology, protecting our children's education. So those will be the three things that will be that. It needs strong public health approaches, including, again, testing, tracking, and treatment. Across the three protections, we cannot protect our borders, either airports or land crossing, without increased testing. And if you test people, you need to know what the outcome will be. If you test people, there are only two outcomes. They will be positive or they will be negative. Those who will be negative, fine. Then those who are positive at borders, what do we do with them? And then how do we, you don't want to create a holding at the borders where you don't know what to do. So we need to think collectively on what to do with that. Second, we need to deploy technology to support our protecting the economy so that we can at least protect hotels, protect businesses, protect touristic resorts, and take this fight to the virus and say, we are not going to yield to you the virus. We're going to deny you the opportunity to transmit, and we are going to keep our businesses open, but we'll track you and make sure that we know where you are by increasing surveillance and making sure we detect the hotspots in time to deploy our PACT initiative, which is the test, the trace, and the treatment. So the point I'm making is that the test, trace, and treat component will drive the overall approach as we ease down the lockdown of our economies. It will drive the saving lives and saving economies as much as possible. Then thirdly, as schools, we cannot, we have to protect the future. And we have to know that by opening up schools, we need to make sure that we have testing done appropriately. We have surveillance that is done to detect what is going on. And also live with the fact that we're going through a series of waves where we open up the economies, we lock them down, we open up, we lock down until we win this enemy. That's how we're going to take the fight to this enemy's camp, by showing that we are not going to retreat and win a war, but we are going to take the war to the enemy's camp and do that. Let me then just conclude by saying that this will require a whole of society approach, where we make sure that we cooperate with the community and develop community leaders. So develop civil society leadership and develop religious engagement such that people understand what we are trying to do, and that is not punishment by asking you to do a test at the airport, and should that cooperation between the different components of the society will be very critical. Let me then just end up by the 5 things that I think we have to do to make sure we do this right. First of all, I say that again, we can't repeat this enough. We have to test and test and test, access to testing, followed by tracing. Second is the community workers. We have to deploy a large number of community workers to trace this. Thirdly is that we have to build a relationship with our community leaders. And really not, it's one thing using community healthcare workers, and it's one thing making sure that the community leaders have a role to play. I'll give you an example. Imagine sending 5 people to go to the neighborhoods in capital cities that are not very privileged to do contact tracing. If the community there has not been sensitized, if the leadership in that community has not been sensitized, those contact tracing will not work. So that is why the whole of society approach is very important. I mean, that is just, those communities, you look at it from far, it looks like where there is no order there. Yes, there is order there. People are living there, they are organized. You have to understand those systems, that how they organize before we encroach it. Then lastly is really, we have to increase mask wearing as much as possible at both levels. I mean, both saving lives and saving our economies require that when we travel, we mask ourselves. And that's what we do. And lastly, the political leadership is so important. We have to really take on the political leadership, encourage our political leaders to exercise, show boldness, wisdom, and courage as they lead us in this. We shall be in this for a long haul. Let there be no doubt. I mean, this is not an Ebola crisis where you run it for 5 months, you control it, and we go away. We shall be living with this virus as a continent for so long. Again, thank you for the opportunity to share my reflections with you.
Thank you so much, John. A really great amount of information. First and foremost, we salute you. We salute you as players in Africa, as health professionals and leaders in Africa. We also salute you from the partners of the private sector and from all the stakeholders who join in to this continental collaboration. We will back you. We will back your team, and we'll continue this journey together. Your message is clear for us. We have a clear thematic building of ammunition from testing team, tracking team, treating team, and your message of leadership is something that I know ADA will also take to the Kenyan government, but it will inspire many others who've tuned in, who are connected to the governments all across the countries. I would also like now on testing to invite a company that we all know, many of you who are in the healthcare industry do resonate with a name called PACT Dickinson. And the BD family has been in the forefront of diagnostic, treatment, supporting care globally. Have a watch at the clip before I invite Renuka to give her intervention. Here it is.
We're behind you every single day. It's why long before COVID-19, we helped wage battles against polio, tuberculosis, and HIV. It's why we're in this fight right now, and why long after, we will keep doing our part in support of human health. It's what we do. It's our entire reason for being.
It's my pleasure now to invite Renuka Gade, who is dialing in from United States. Renuka is the Vice President of Global Health at BD. It's a pleasure to have you here joining us, Renuka. Over to you. Give us your brief. Thanks.
Thank you so much, Amit. First of all, thank you for having us on the panel today. And it's, as John said, it's always exciting to be in a session when you're moderating, because you always feel it's still brand new and not repetitive. So I appreciate that. I also want to acknowledge Dr. John Nikungasang for his kind comments. And unknowingly, I actually have comments about him in my presentation, so you'll see that as well. But if we move to the next slide, I want to just kind of start about who BD is, and that's in the next slide, please. The video said it's our reason for being, and that's how strongly we believe that if we are present, we have to be global. We're a global company with 65,000 associates, but really the purpose of global health is to look at equitable access and to help all people live healthy lives. Not always simple, it's complicated, but we've been around for 133 years, long before any of these viruses morphed the way they were now. Of course, the viruses have been in existence for centuries, but we've seen many viruses come and have seen how we can break their will collectively through technology, through leadership, through public-private partnerships, and through local ownership, which are all key elements of the discussion of test, track, and treat as well. So if we move on to the next slide, it will talk about our history with Africa. It's been a long history of the 133 years. We've been in Africa for over 50 years now. We have a strong local presence with headquarters in 3 different regions in South Africa, in Johannesburg, in Kenya, as well as in Ghana. So we have a strong team on ground that's servicing the needs of Africa. But I picked these 2 areas, which are the areas of global health that we work on. We also have a strong history of partnerships, so to say. So the program Labs for Life, and this is how I first met Dr. John Nikingasang when he was in CDC, really is still currently ongoing in Africa. And the focus of that program, simply to say, is to strengthen lab systems for high performance and quality. Not everyone understands the word quality that intuitively, but years ago, this was the vision of leadership at CDC and PEPFAR to say we need to build strong labs, and needless to say, the need for strong lab capacity is now more than ever, as evidenced by this pandemic. So we've been working with many countries over these years, helping labs move towards the SLAMTA process to gain ISO 15186 accreditation. We will continue to work on projects such as that. We also have a partnership with PEPFAR and CDC for Africa to strengthen clinical practices, practices such as infusion practices, blood drawing, phlebotomy, or injections. And again, when you think about it and the patient is in the hospital, all of these clinical procedures are actually being performed on the patient. So really, we've been building these systems or helping work hand in glove with Ministry of Health teams, and it's been an amazing story. You work in Africa and you just don't want to leave the continent because there's so much that we can do together. We learn as we teach, and collectively we can drive that change. If you move to the next slide, that will talk about the next slide, please. This is where I was going to talk about John and really say, for years now, we've been looking at collaboration with him, via him, for what we can drive on the continent through our Labs for Life partnership, which was established and renewed in Washington, DC in 2012, through the programs that we've had with him on driving focus on TB. A big part of what we do depends on leadership and the vision. It was in very early days that they had this vision to say there is a need for public-private partnership to work together. Yes, companies bring products, bring technologies. There is exchange of sales and marketing activities that happen, and that's one pillar. But companies also bring, along with that, a bunch of core competencies that can benefit a whole health system. And that vision to say we can have public-private partnerships to work independent of each other was really established by leadership right here. And to me, there's no question, as COVID-19 is taking different forms and scaling the way it is, that we will have to commit to Africa. We will be working with leadership hand in glove. If you move to the next slide, this slide really gives you another example of a more recent collaboration that we've been driving with the Fleming Fund, not so related to COVID-19, but in the space of AMR, antimicrobial resistance. Through the program, the Fleming Fund, we will be working across 19 countries in over 98 labs and with about 100 of our instruments. And we were in Uganda just before the COVID crisis broke out. Actually, I was there in February, and little did we know that the world would change so rapidly. But again, why do I show this slide? It's really to, again, reinforce that the need for strong labs is now than ever before. And if you look at the link of COVID and AMR2, you're finding a WHO study that in 72% of cases, COVID patients were treated with antibiotics, which was not kind of the response that was required. So again, driving the connection between, it's not just about COVID, but if you strengthen that system, it's about connecting the whole gamut of viral or bacterial organisms that can strike the world any time and point, as evidenced now. If you look at the next slide, then it talks more about what are we doing in the space of COVID. So we have two solutions. One is a PCR molecular-based lab-based system called the BD-MAX. BD-MAX has, it is a bigger instrument and needs a lab, so to say. So it's not your point of care solution, but BD-MAX was rapidly scaled. I tell you, COVID kind of changed the way even big companies look and at how big companies look and work, because we rapidly had to establish a manufacturing line to cater to the demand. Arguably, a big footprint of BD-MAX is in the United States and Europe, but even then, we were not prepared for this kind of demand, so to say. So very rapidly getting past FDA, EUA approvals, getting past the capacity expansion, and ensuring that this lab-based molecular test was widely available. And remember, the way the US peaked and continues to is very different in contrast to what's going on the continent. So that was kind of our first response. But we knew that a lab-based solution has its limitations, even though PCR has the highest performance characteristics. And so if you look at the next slide, you will see that we just launched, and we actually have received FDA EUA approval for a point of care platform. Literally, this is almost the size of your iPhone, and it can fit on your palm, so to say, but the Veritor instrument that provides you a result in 15 minutes with an 84% sensitivity and 100% specificity. And that's a pretty strong performance quality right here. And as we speak, I heard a previous comment about tests should be allocated across the globe. This is the problem that we're struggling with right now. We just launched this test. We have to think about how do you get this past the United States to low middle income countries where the need is. How do we further simplify the solution? Should we be looking at a visual read only test? All of these discussions are actively being debated within the company. And we've initiated some discussions for Africa, for the continent of Africa, where we want to earmark some tests no matter what. And that's the conversations that we're having with the leadership now. So I'm hoping very soon to come back with some good news on what we can do with this product right now, while we are looking at getting a much more accessible solution, even more accessible than what we are seeing here. So that's the stage we are in. And I also want to say this is the time that we should think of public-private partnerships, because it's one thing to have access to solutions, even such as this, but I think, as John may have said, when you're taking this out, when you take this out into the communities, you need an entire health system. You need some level of communication material, training, and support And especially when you're linking this back with surveillance and data, how do you make sure that everyone's working together, industry, governments, and the communities themselves, so that the data becomes available in a epi store, if you will. So all of these are discussions that we are having as we speak. We really are committed to saving lives and saving livelihoods. The path might be to go with what you have now and then kind of keep driving that to improving further and better. But that's kind of the latest update that we have for this particular product. And needless to say, we are challenged again by the capacity that we have and the demand that we have to serve, with the US government putting in a very big stake on wanting a lot of the volume for the United States. So that's where we are with this platform, so to say. If you look at the next slide, then I also want to touch upon a comment that was made on immunization. BD actually has a very rich legacy in immunization. We invented the world's first auto-disable syringe, which is a syringe that has a fixed dose of vaccine that locks upon injection, so that it can't be reused from patient to patient. And we all know that the World Health Organization and other agencies have published data where injection reuse from patient to patient can result in the spread of HIV and hepatitis. So we have to be very careful at this point in time that as we're responding to the pandemic, enough planning is being done to ensure that you have the right syringes to accompany the vaccination. So we have dialed up discussions with UNICEF. Typically, Gavi funds programs for several LMIC countries, and UNICEF is the agency that consolidates and procures these devices, so to say. So we're in active discussions with UNICEF to say, what do you need? Do you need us to start up a new line? Do you need us to stockpile? And how can you prepare for this vaccination surge? Because again, devices are often left behind. You only think about the vaccine, but you need the right delivery mechanism as well. And those discussions are proceeding really well. There is already a very strong focus on LMICs for routine immunization. And so this discussion is naturally moving along nicely. And again, we hope to announce something very soon on this vaccination front as well. So,
thank you, Renuka. We want to move on.
That's the
is
story
that your
of
story? Yes. Good, 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 good. I mean, literally, we couldn't thank you enough. First, we want to congratulate you. We know BD, not only in the diagnostic front, the size of your iPhone, that's truly amazing. So small, we need it. But we also are very happy that you're going to make the vaccination easily available. Thank you, Renuka. Now, after we test people in Africa, what next? So what? Now we've tested whether it's positive or negative. So like John says, if you're positive, we need to then trace so that we contain. After we know it's positive, we need to trace. So before we go on to tracing, I want to invite one of our partners, SAP, who is a non-technology player, have a watch at what they want to show you before they give their presentation. Here's the spotlight video. Thank you so much. It's now my utmost pleasure to ask Manal Halwani, who is the healthcare industry leader based out of Dubai. I know it's a holiday and a vacation there. From SAP, she's going to take us through how do we manage tracking in the best way possible. Manal, welcome. Over to you.
Perfect. Thank you, Dr. Amit.
We can hear you clearly. Go ahead, Manal.
Okay, great. So essentially, our company is a technology company that operates in multiple industries, and a lot of our customers today have resorted to us to help them in the COVID crisis. And they really resort to us normally to help them in their core operational processes. So things to do with their people, their resources, even signing documents during the crisis. So that's the area where we operate excellently in. And then we're present at a global level in around 190 countries in the world. And in Africa, we also have a very strong presence with multiple countries where we're present, including South Africa, Kenya, Francophone Africa, and the continent as a whole. So in my topic, it's really about how can technology support tracking, tracing, and testing. So if we think about it, and as Dr. John mentioned earlier, is if I identify the patient, but then I can't help him isolate, for example, using technology, or if I can't coordinate an overall response in an organized way, then it's really hard to win in the fight against COVID. So that's the key thing that some of our customers came to us for help in. And the way we looked at it is that there are 4 main areas where we can help. Well, first of all, when it comes to the patient, it's about identifying the patient and handling them and their information, essentially. The second part is about the practitioner. And when I speak about the practitioner is how can technology help them work effectively and be listened to, right? So it's important to capture the practitioner's feedback these days, because through that feedback, sometimes we can identify maybe areas where things aren't working very well in the COVID response. And the third area that we help in as well is the health providers. So how can they manage their employees, their capacity, and also their resources, right? So that's also a very important area when it comes to healthcare providers. And finally, when it comes to government or public health providers, it's about having enough information on hand and having really the visibility at an overall level, right? So can they actually see where outbreaks are happening? What type of data do they need to improve things and improve the processes that are currently running in their country? Because obviously the response against COVID is a countrywide or regional response that needs really strong coordination. So what I want to do in this presentation is really share our experience and some practices that either governments or regions came to us for help in. So if I can move to the next slide, please. So remote health questionnaires, right? So in this situation, sometimes in certain places, maybe there isn't enough testing capacity or not enough maybe workers that have the skills to perform the testing, for example. And maybe the public health authorities would like to rely maybe on symptoms reporting as a means of identifying patients. So where technology can help. So you can administer questionnaires that ask people about their symptoms at a national scale or at a regional scale in a very fast and rapid way. And then get back the data in real time. And based on this data, you can maybe visualize it and try to identify based on symptoms that people are reporting where you might have outbreaks. So this is something that can be done in a fast way. It's obviously not going to be as accurate as testing, but it's still a good idea to maybe have this gauge from the community on where you might have problem areas in a certain region or country, for example, or a certain community, let's say. Obviously, this will work well if you have maybe a high mobile penetration or a means of administering those types of questionnaires, or maybe even where you have community health workers that could act as the agents to actually administer these questionnaires on symptoms in certain regions and geographies. And the value from this is also for the public health organization is that you can start to visualize and look at your data in a real-time way, and using really smart AI to have visibility on this data and for it to be analyzed really quickly. And even maybe you can also append a call center, and then the call center can contact certain patients that might have problems and then route them to the right places, really. And in Asia Pacific, for example, some of our colleagues also had the idea of, okay, so maybe we can recommend to isolate people wherever they are if they're presenting symptoms, and then check that they're adhering to this isolation based on SMS technology, let's say. Obviously, after they give consent from a privacy standpoint. So if I can move to the next one. So in the US, the state of Iowa, for example, used this technology to even go a step further. So after administering this questionnaire, let's say to the patients, they can route them to a testing center where the testing can happen. And they even use this technology to actually, for the triage forms that the healthcare workers are using. So on one side, we've contacted the patient, then we've followed up from an end-to-end process perspective, what's going to happen with the patient and how he's going to get handled once he reaches the required testing center, for example. So if I continue, and the thing is that this is very fast. So it's a very fast way, very fast deployment for the technology because it's cloud-based and it's quite flexible to use. If I move to the next slide, please. Now, after testing and after patient identification, we also need to do contact tracing. And at SAP, contact tracing has happened for certain customers in two ways. So the first one is through self-reporting, right? So for regulatory reasons, and in the district of Boblingen in Germany, and it's a district, essentially a full district, we've asked the patients to trace their contacts. So suppose someone has been identified as a positive case. They will need to actually report their contacts, and then the healthcare workers in that district will need to maybe contact the impacted people and then continue the process from there. So whatever the guidelines are from their CDC or public health organization. And by doing that, it's really having an automation and a systematic way of preventing the spread of disease. So the healthcare worker in this context can either ask the people in contact with this person to come and either test, or maybe self-isolate, or do something else, right? So that's the key idea. And then from this, we also get a lot of data as well. So you can collect data, the public health organization can visualize it, design a better response, and that's how it works. And now the second way of doing contact tracing is an even more automated way. If I can move to the next slide. And then it's something being done for the German government. So this methodology is contact tracing with very strong privacy. So SAP has developed a technology whereby only the person infected knows that they are infected, and then reports it via an app. And then this app would actually send notifications to whoever has been in contact with this person at around 2 meters, let's say, telling them that, listen, you have been in contact with someone or came in close proximity to someone that has COVID, please pay attention, let's say, or whatever needs to be done from a public health perspective at the time. So, and then the next thing is that this really inspires trust in society. So they're really sure that, first of all, their patient information stays with them, and then that we're protecting society as a whole. So people can actually trust downloading this app and feeling safe. And this helps also in opening up economies as well, because it's by deploying something like this, you can maybe empower the communities and the patients to take care of themselves during the COVID situation and crisis. We've even open sourced this technology to demonstrate the strong privacy features of it. And yeah, so it's one of the most advanced and even most accurate, I mean, with a very high level of accuracy when it comes to measuring the distance and the contact. So I think that's one of the key features of it. In addition to this, it's also you can also add in additional technologies to do a visualization of all of the data at a national level, let's say, to view what key information that can come out in the COVID situation and crisis. Okay. So thank you very much, Dr. Ahmed. It's back to you.
Thank you. Thank you so much for that presentation. I think it's very clear that leadership, all of you have spoken about government. You also spoke about the German government, and John and other speakers talked about leadership that the government need. Now, way before COVID, some of the countries had already taken health as a top priority in government intervention towards prosperity. Have a look at what the Kenyan government talked about the Big Four agenda and where they placed health before I invite Adam Wongola from Kenya Vision 2030, which is the government arm when it comes to progress and charting a strategic plan. So have a look at Kenya Vision 2030 video. Here it is for you. You see leadership by the president himself on the Big Four agenda after Manal's presentation on involvement and inclusivity. Let me now welcome Adam Wongola, who is the director, social and political pillar at Kenya Vision 2030, to give us her presentation. Welcome, Ada, over to you.
Thank you, Amit. It is a pleasure to be in this forum again, and thank you for your long partnership. Could I have the slides, please? Yeah, the next slide. So you saw in that video that we are responsible to coordinate the Kenya's development agenda. And my presentation is about this perspective. It's very broad. It's not necessarily on, really on health, but because of the COVID situation, I'll highlight what the health sector and health situation is. So the Big Four agenda, as you saw in the video, was launched in 2017-18 when the current regime came into power. And amongst the 4 items that they prioritized was universal health coverage. And this would focus on social health protection, access to health insurance by 2022, access to fully equipped health centers, and reducing the number of kilometers for access, and establishment of 10 new referral hospitals, and increasing the number of health facilities at the community level, including mobile health services. And as you'll see later, this has come in very handy in the context of COVID. Next slide, please. So the overall goal is equitable, affordable, and quality healthcare at the highest standards. And this is captured at in the Vision 2030 and the current medium-term plan that's being implemented. I will highlight 2 particular projects in this plan. This is the medical tourism program and the health infrastructure program. But all the other programs also are basis to bring in the COVID context so that it contributes to overall health of the population. But particularly these 2 programs have come out in the context of where private sector can participate. Next slide, please. So what has been the COVID response since the first reported case in March? So the government has established the National Coordinating Committee on Response for Coronavirus Pandemic, and this has been updating the population every single day on the situation in terms of how many people have been tested, how many people have been confirmed positive, and how many people have recovered and how many deaths. Then the second bit is the COVID-19 Emergency Response Fund, which is mobilizing funds from all other partners, and especially private sector participation. And the board is constituted of private sector participation. And so far, they've helped the country in terms of the preparedness at all levels, such as purchasing of masks, erecting hand washing stations, availing adequate supply of soap and making available sanitizers, providing public education on awareness and creation to the population, equipping health facilities, appropriate infrastructure for isolating persons found to be positive, equipping testing laboratories, necessary equipment, reagents and testing for presence of the virus, and investing in personnel, technology, and tracing of contacts of people. So this fund has largely been responsible for a lot of scale up in terms of testing, tracking, and treating. But all funds coming from private sector and other partners outside government. Next slide, please. So in terms of testing and tracking, and this source comes from the Ministry of Health updates from the committee that I mentioned earlier. They've been updating the country every single day. And as at yesterday, the Kenya had tested close to 300,000 people for the blue line there represents the number of tested people, close to 300,000 as of yesterday. The orange line is the line of infections. So you can see there's still a big gap, and I really appreciated the key speaker who spoke about how lucky we are in terms of numbers that have tested positive compared to the number of tests. So our positive numbers, number of deaths, number of recoveries still remain pretty low, and this is where we're lucky, and probably we can capitalize on this. But notable is that although the tests are 300,000 at the moment, we need to do much more testing, and I think the previous speakers have alluded to that. And every month, you can see how many numbers Kenya has managed to cover. So from as low as 1,300 almost in March, in July we had tipped about doing close to 126,000 tests every, in a single month. Next slide, please. So what are the opportunities for partnerships? We have, continued provision of high quality private medical care, manufacture of affordable health commodities and technologies. And I'm so glad to hear the previous speakers talk about this, because these are very potential areas of partnership. Medication, this is a high cost in terms of treatment. Digital solutions, we've seen that, more and more, Kenya being a developing country is very fast adapting to digital solutions. Financial resources, of course, still remain an issue and have to be upskilled, especially for emergency and in case there's a surge in number of infected persons and number of deaths. Next slide. So again, in terms of the medical tourism project that I mentioned earlier, servicing that ecosystem in testing, tracking, treating, isolation centers, food and nutrition. We've seen a lot of participation by private sector in terms of providing food, mental well-being, counseling, and so on. And then there's the public health measures, that infrastructure at the community level, hand washing, sanitizers, face masks. Again, still huge opportunities there. Support to counties to meet the requirements, because every county, Kenya is made of 47 counties, have been given targets by the government to reach in terms of containing the virus and the spread of the virus. Next slide. So what has the government done in terms of making an enabling environment to enable this private sector engagement and participation? Currently, their global supply chains are changing, so they're being reconstructed, and government is ensuring that that Kenya and private sector is able to participate more in those global chains. Kenya is negotiating with US and UK after Brexit in terms of bilateral trade. And again, a lot can be said that I'm sure Amit would know more about this. Kenya, recognizing that they need to be self-sufficient in terms of medical commodities. There's heavy emphasis on local production and manufacture, and the manufacturing sector is fast adjusting to that. We must produce competitively to be a competitive nation. So investments in infrastructure, energy, and facilitating anything that needs more regulation is receiving a focus in the current plans. And Kenya is currently, looking up at an economic recovery strategy. And these are some of the initiatives that are seeing what can they do in terms of the regulation. Okay. Thank you, Amit. I'm just getting to the last slide.
Okay, well done. Mm-hmm.
Yeah, so we are ready. We are live towards the changes, their policy adjustments, and we really look for opportunities, and upscaling the testing, tracking, and treating is a priority to achieve universal health coverage. Thank you very much.
Thank you, Ada. Thank you, Kenya Vision 2030. Keep up the good work. We have so many questions. I'm a testament of true public-private partnership in Kenya. It may not be perfect, but working together has totally displayed how we can be stronger. Let me now move on to AstraZeneca, a multinational that we know is based out of Cambridge. It's a British-Swedish pharmaceutical and biopharmaceutical company. We all know the wonderful work that you do. Ken, we really want to also hear about vaccines. We're going to be totally impatient. Everyone on this call wants to be on that discussion, and we don't want Africa to be left behind. So ladies and gentlemen, please welcome Mr. Kennedy Jau, who is the Government Affairs Director in Sub-Saharan Africa, AstraZeneca. Ken, over to you.
So thank you very much, Dr. Amit Thacker. It's indeed my pleasure to speak at this great, platform that you put together. And my first interaction with you was last year, actually, where I had the pleasure to speak at the Addis Ababa meeting. It was a fantastic meeting, and when the opportunity came up again, I said, I think I definitely would like to be part of this. So thank you very much to you and to the Africa Health business team for inviting me, and to all the other panelists and everyone that has made time to attend this afternoon or morning, wherever you are. So I think very importantly, this is just a disclaimer to say that these slides are approved for external use, so you can have them after the discussion. So the next slide really is just really to emphasize what Dr. Amit and the team earlier on had mentioned, the need for collaboration. So I think the key, should I say, themes of today are the need for partnership and collaboration. And for me, the second one is the fact that Africa should not be left behind. And as you can see, our COVID response is based on 4 core objectives as AstraZeneca globally. One, to provide emergency relief and humanitarian support at this time, and then to ensure continued care and patient safety and strengthening capacity of health systems, which I think we all recognize that have been broken at this point in time because of travel restrictions and everything that has come with the COVID crisis. There has been a breakage of referral systems and the ability of the health systems to really serve people, both for COVID as well as for other diseases. And also very importantly for us has been to protect our staff as well as our customers when we're involved in the supply chain and ensuring that our medicines continue to reach the last mile, even with all the restrictions that are currently ongoing. Then very, very importantly, and I'll mention this a little later, is our contribution in terms of research and development and our efforts to combat the virus from prevention, and I'll mention a little bit of the research that we're doing, including the vaccines that I think you all probably have heard of, and there has been media coverage of the work that we and other companies are doing. So next slide. So just to talk a little bit about what we're doing in terms of contributing to emergency relief efforts, we've donated more than 9 million masks, face masks, and surgical gloves, PPEs across the world, and Africa has not been left behind. And I'll show you exactly what I mean by that. And we've also partnered with stakeholders, the World Economic Forum, as well as the WHO, to identify the needs and to respond in an agile manner. Next slide. So yes, you see, Africa has not been left behind. We have worked with ministries of health to support our healthcare workers. And I think the number one thing we can do for our healthcare workers, frontline healthcare workers, is to keep them safe. Yeah, that's the biggest worry. They have families, they are, human as we are, but they're out there working and putting their lives ahead of us, of everyone else. And we really need to protect them. So we've worked with the ministries of health in Kenya, in Ghana, and I'm glad to say just about 2 hours ago, about 35,000 masks donation landed in Addis Ababa, and next week we'll be doing the same for Ivory Coast. So we are around Africa really working to support healthcare professionals, to really help protect them and give them confidence as they do this really great work that they're doing. And as you can see below that, we are also committed in terms of COVID-19 testing. Next week as well, we'll be delivering some testing equipment to the Kenya government and a few other governments in Africa. So we're completely 100% committed to the African patient, as well as our governments and our healthcare professionals. Next slide. So this is really, really important to note that besides COVID-19, what the COVID crisis has had an impact on non-communicable diseases as well. And we are very, very impressed actually by the Kenyan government and many governments in Africa that they have continued to do the best they can to deliver non-communicable disease care across the country. And as much as there was a lockdown here in Kenya, we know that the NCCP in Kenya have really worked hard to ensure that the 13 MOH cancer centers are up and running. And I know, in around March or so, 1 or 2 closed down for maybe a few days, but the ministry was very agile to ensure that there was continued cancer care across the country. So we, as a company, do feel that we need to partner with them and partner to ensure that there is continued care, and that's in line with the universal healthcare coverage that our ministry and our government is committed to. Next slide. So number one is to protect our healthcare workers. What's really important, the second very important thing that we need to do for our healthcare workers is to empower them. There is so much information that's coming through right now. We are all learning something new every day about COVID-19, and empowering our healthcare professionals with the knowledge to be able to perform and to do the very best they can of patients is really our utmost responsibility in the private sector. So you can see here we have partnered with the healthcare professional societies across Africa, and I want to emphasize something that you see on the title there. It's been an Africa-wide effort, not just Kenya, but we've been able to reach about 15 countries, more than 15 countries, and working in collaboration with all those societies there. And those are just some of them. There are many others that we've worked with to ensure that we support them to be able to deliver very important, should I say, fast-paced, a lot of information that is developing at a very fast pace that is very much needed by healthcare professionals so that they can perform the very best they can. And we've had about 71 educational events and supported these events that have been attended by over 20,000 HCPs and more than 24,000 portal impressions. So we're completely and 100% committed to these digital touch points. And one thing that really, really impressed us is how very agile our healthcare professionals were in pivoting to digital, and including public facilities. So we are able to reach urban, rural, all facilities across Africa. In fact, our first, webinars used to be attended by more than 1,000 doctors. And these webinars did not talk about AstraZeneca products. They focused really on COVID-19 information and knowledge, which was non-promotional scientific information in order to empower our healthcare professionals. And many of these actually developed their own lives, and some of them that we initiated, other companies joined, which is fantastic. And even we now have global partnerships from Africa. For example, the Pan-African Thoracic Society is now partnering, or did partner, with the American Thoracic Society in order to have a global event where there was best practice sharing between the US and African doctors. Next. So very important for us is to ensure continued supply until the last mile. And this is critically important because we know with the travel restrictions, a lot of supply chains have been interrupted, but we are totally committed to ensuring that every patient does get the medication that they need. Next slide. So and this is also quite important. Our R&D's focus around COVID-19 is partnership, right? Not just us as a company. As you can see on the left side, we have a diagnostic development partnership with GlaxoSmithKline, which is another pharmaceutical company. This is a very specific initiative for the UK government, supporting the UK government in terms of testing. But like I said earlier on, Africa has not been left behind. And next week, actually within the month of August, we'll be supporting several African governments in terms of testing as well through our donation of testing kits. The second point is on monoclonal antibody research. We do have proprietary platform that is developing monoclonal antibodies. And what our researchers are trying to do is to develop an antibody against the virus. So as we know, which mimics the body's own natural antibody. As we know, it's quite important to help the body fight, as it were, the virus. And besides the vaccine, which I'll talk about, we are also working in terms of developing an antibody that will be used for prophylaxis of, should I say, in patients that are exposed, to minimize the progression of the disease and to minimize the complication rate. And the third one is a collaboration actually with the UK government as well, with Wellcome Trust and with academia in developing other potential therapies, treatments. These are still ongoing and in ongoing studies, and they are still being looked at and being explored, but it's a partnership as well that is quite open, that is multi-sectoral, and is looking at developing therapies. The last one on the right side, and this is what Dr. Taka alluded to, is our collaboration with the Oxford University in developing a potential COVID-19 vaccine. And you may have seen news about the early data that has come out of the phase 1 and phase 2 studies, which has been positive in terms of acceptable safety profile of the vaccine and being able to induce immune responses, both humoral, that is forming of antibodies, as well as cellular in terms of T-cell response. So we are looking forward to having this vaccine it has already gone into phase 3. We are looking forward to seeing what the results will be, but I must emphasize that we are still in the trial phase and we still have to show safety and efficacy. Once we do that, the regulators will approve, and then we'll go into manufacturing and a supply as much as possible around the world. Two things I want to end by saying is that as a company, we are committed to equitable supply and access around the world of this virus. And we recognize it's not one company that is going to satisfy the need right now. It's a great global need, but other companies will do as well. And we are looking forward to being able to partner with everyone else. And as we speak right now, there are a lot of manufacturing networks ongoing around the world in order to be able to develop supply chains that will avail the vaccine to as many people as possible if it does indeed prove to be successful. So that, I think, was my last slide. And thanks very much.
Thank you, Ken.
I hope I
Thank
kept
you.
time. Yeah.
Incredible information, especially around the whole era of vaccines. We are reading, we are watching you. I want to thank the over 1,000 people who registered for this webinar. Many of you on YouTube, some of you are here. It's a public holiday in many places where mothers are together with their children and spending a great day together. Talking about mother and women in Africa, here is a clip from UNFPA, one of our partners, talking about good family health and good family life. Watch the clip.
هر روز نگران این هستیم که مبتلا به این شده باشیم.
خايفة أنا على بيبي اللي ببطني، بس أنا الإجراءات اللي أخذتها أكيد حتكون وضع تمام.
كلهم عم يجوا الخوف مالي بقلبهم والرعب إنه خايفين من هالموضوع انتشار كورونا شو أثره على الجميع.
Podíamos um efetuar de sidolin, anti, mendoi, sidoven bebat.
درصد که میترسم، ولی خب اگر ما هم توی این بحران شونه خالی کنیم، احساس میکنم مثل که خط اول یعنی خط مقدم و خالی میخوای بکنیم و این الان توی این شرایط موقعیتی نیست که من این کار رو بخوام انجام بدم.
Also take a moment to thank the midwives, thank the mothers. It's an incredible job that they're doing. As you celebrate Eid al-Fitr wherever you are, take a moment to appreciate a midwife, appreciate a mother, and together in Africa, we should make a difference in saving lives. I want to go to the parting shots, and as we move to the next slide, I want to thank the following people who actually sent in their questions early. So if you move to the next slide, I want to thank Nana Beth from South Africa. The questions are to Lumira. Next slide. I want to also thank Robert Kaba from Ghana, who sent a question in to BD. And I assure you these questions are being sent to the panelists and your emails are with us. We will give you a full response on these questions by email. Next slide. I want to thank Kanyata Sunkutu, who I know well from UNFPA. Again, a question for SAP Manal to you about tracking and tracing. That's here. Thank you for sending that question in advance. Next slide. I want to also ask Ada from Kenya Vision 2030 to make sure that we respond to these two questions. We've got journalists online, we've got health champions online, and we've also got community-based organizations like Ronald Keter and George Kibaso, whose answers will be sent by email by Ada. Next slide. AstraZeneca, Ken Zhao, for you. You've got questions coming in from training academic colleges like KMTC. You've got a private hospital, City Health Hospital in Kenya, that's sent you questions. All these questions we have been sent to the panelists, ladies and gentlemen. The next slide. And this is really to John Kengasong, Africa CDC. You have the president's advisor from Namibia, Dr. Bernard Haufiku, who is also the founder of Africa Public Health Foundation, sending in a question here in advance, really about also leadership and making things move to the right level. We also have a question from the Community Health System Strengthening Advisor from AMREF. Next slide. and John is going to give us answers to that. I'm going to take on a few questions from Cameroon that's come through and South Africa on how we can strengthen partnerships and whether we can manage COVID in a different way. I want to thank abundantly the questions that have also come live. I want to also thank all the speakers, moderators who are in the previous webinars who've logged in. Claire Omatse, who's going to be the moderator for the next Friday session. I want to thank you. At this point, I want to turn it over to parting shots. And if we go to the last parting shots, I want to start with Mark, and then I'll ask Renuka, Manal, Ada, Ken, and we'll end up with John's parting shots as we close the webinar. I request to keep it just for 1 minute. Mark Matthews, your parting shots can begin now. Over to you.
Thanks, Amit, and I'll be brief in the interest of time. I think the 13 million test target that Dr. John Kingerson mentioned right at the beginning of the webinar should not be a negotiable number. We understand the value of testing, but also tracing and treating and isolating. So I think really decentralizing those three elements into communities, building a good, strong community response to COVID, reinvesting in primary healthcare, building and re-engineering our primary healthcare is also non-negotiable in this process for our response to COVID, but also to the next epidemic and really to take care of the other and manage effectively the other high disease burdens in Africa. So we look forward to collaborating and partnering with you and with the other people in this call in this fight against COVID.
Thank you so much, Mark. We'll definitely work together. Renuka Gade, over to you for your parting shots. Renuka, are you with us? Let's move on to Manal.
I am here.
Ah, yes, here you are, Renuka. Your parting shots.
I just say the time to act is now.
Okay.
If we don't act now, it's lives lost, livelihoods lost, public-private partnerships, and I'll end by just saying what Dr. John Kingerson has already said. If you don't solve the COVID problem in Africa, you've not solved it anywhere else in the world. So COVID anywhere is COVID everywhere. So coming together now is more important than ever.
Spot on. Couldn't agree with you more. Manal Halwani, over to you for your final words. Hello, Manal. Are you with us?
Yes, sorry, I was speaking on mute. Dr. Amit, what I'd like to emphasize is really the importance of technology in coordinating and managing the response, and also being able to reach maybe faraway communities or creating even awareness in those communities on the importance of prevention, tracking, tracing, isolation, and testing as well.
Wonderful. And we'll be carry on with our engagement with SAP. Adam Wangola, Kenya Vision 2030, keep the flag flying high. Parting shots from you.
Kenya is focused on achieving universal health coverage by 2022. COVID has come, it's a disruption, but we are still focused. And there's gaps to do more in testing, tracking, and treating. And we really look for these partnerships, either private, public, and partners. Thank you.
Thank you so much, Ada. We are with you. Kennedy, you made a sterling statement. Africa is not going to be left behind. Parting shots from you.
Absolutely, and thank you very much for this opportunity. And AstraZeneca is a global, pharmaceutical company, but very much committed to Africa, to the African patient, to the African healthcare professional, to African governments, and to all stakeholders in health in Africa. And just one thing I want to say about our research and development, there's a lot that's ongoing in terms of addressing this crisis, and specifically on the question of vaccines, which is quite topical right now. We are working on partnerships with Gavi to ensure that our African governments and our African patients or African populations will access these vaccines in an equitable manner and at no profit during the pandemic. So this is a commitment from our company, and really looking forward to partnering with everybody to make this burden of a lesser impact on our African population.
Thank you so much, Ken. John, Africa is ready to fight. The army is here. there are several people ready to go into the battle together. We will work with you, lead us together. What should we do? What are your parting shots so that we don't get fatigued before the real battle starts?
Absolutely. I think we can beat this beast if we work collaboratively, if we work in a coordinated fashion. Very importantly, the whole of society is critical here. It is all our collective responsibility and collective accountability. Test, trace, and treat will remain the cornerstone for our victory. Those are the arms that we have in our toolkits now. Leadership of the continent is so important. The continent, I really want to give a call out to the leadership exercise by President Ramaphosa in his capacity as the chair of the African Union and the African Union Commission chairperson, Chairperson Moussa Faki, for the wonderful leadership they are orchestrating. Join us as we launch in the coming week our Saving Lives and Saving Economies initiative, Know Your COVID Status. So I look forward to the partnerships with the private sector to drive this campaign that will be starting in the month of August throughout December. Thank you.
Thank you so much. Thank you, panelists. Thank you, John, our keynote speaker. Let me now invite Jacob Magero from the Africa Health Business to take us what are the next steps, what we should be expecting as we start the journey of even becoming stronger with this battle and preparing Africa to fight. So Jacob, over to you.
Thank you, Dr. Thaka, for taking us through the session. I would also like to appreciate the panelists who took part in the session. And on behalf of Africa Health Business, we would like to extend our gratitude to all of our partners who made this event possible. We'd now like to highlight our upcoming webinars. We have our infrastructure and equipment webinar next Friday from 4 p.m. to 5 p.m. East African time. And now, as Africa determines what lies ahead, the partnerships and collaborations within the health ecosystem must continue. Join us for the AHBS second webinar series, themed Partnerships for Resilient Health Systems. On this second series, we will reimagine stronger health systems to continue protecting the 1.3 billion lives, as well as determining economic rebound strategies for sustainability in Africa. And now, we thank you for attending the webinar. We wish you an awesome weekend. Eid Mubarak to our Muslim brothers and sisters, and join us in watching a short clip about AHB before you leave. Thank you. Have an awesome weekend.
Bye, everyone, and thank you so much.
Thank you.